Thank you for attending my presentation on visual aids, healthcare, and the Ontario Assistive Devices Program circa 1982 to 1992. Before we begin, I have no affiliations or financial support disclosures. With the Constitution Act 1982, persons with disabilities became a protected group under the Canadian Charter of Rights and Freedoms. That same year, the Ontario Ministry of Health created an Assistive Devices Program, ADP, to provide financial aid to children in need of assistive devices. Visual aids were one of the final device categories whose services expanded to Ontarians of all ages. This delay culminated in a significant human rights case establishing that the ADP's age restriction was discriminatory. Additionally, optometrists could not yet certify blindness nor authorize visual aids, and significant service provision barriers existed in rural and northern Ontario, limiting client accessibility. Primary data were derived from unutilized ADP materials from the Archives of Ontario, with supplementary sources used to provide additional background and present-day data. Since before the commencement of ADP activities, the provision of visual aids had been solidly rooted among concerns for persons with disabilities. It was ultimately the work of advocacy groups that pushed the committee to consider and propose the creation of a visual aids subcommittee. Visual aids were more costly and specialized than other ADP-covered devices, plaguing the subcommittee's creation through delays due to both financial concerns and the exclusion of visual aids as an ADP priority. It was ultimately the Minister of Health's assent that assured the creation of the Visual Aids Subcommittee. The Visual Aids Subcommittee, chaired by Dr. Jack Crawford, was established 1.5 years after the commencement of the ADP. For the remainder of the decade, there was significant struggle to catch up to other subcommittees and ADP-wide expansion plans. Visual aids were given a backseat compared to other device categories. Between administrative changes and a lack of resources, expansion plans for visual aids to Ontarians of all ages were delayed multiple times. It is reassuring, however, to see that proper attention was eventually given to the Visual Aids Subcommittee and that a more realistic and plausible expansion plan was developed going into the new decade. Agencies and blind persons advocacy organizations such as the CNIB, Boost, and Views for the Visually Impaired have played key roles in the development of the visual aids category. These groups provided insight into the client perspective, advocating for more affordable costs, greater accessibility to ADP services, and pressuring the Ministry of Health to expand the visual aids category to include adult clients. In response, the ADP would welcome direct input through meetings with these agencies so they may explicitly express the most pressing concerns of their clients to the ADP. The confusion and persistence of clients' requests indicate that the ADP was not meeting all of the public's needs, whether they concern accessibility to services or the provision of common visual aids. Specific cases such as that of Edwin Roberts also highlight intrinsic flaws with the ADP, including the human rights violation perpetuated by the ADP's age restriction, which was ultimately ruled to be discriminatory. Lingering issues plaguing optometrists and ocularists became limiting factors in patient eye health. Bureaucracy and legislative entanglement would ultimately impede progress on these advocacy fronts, such that no significant change occurred by the end of the 1980s. The lack of attention focused on Northern Ontario could itself be a reflection of the ADP's priorities with regards to service delivery. With the Visual Aids Subcommittee having both no representation from Northern Ontario and having no service delivery plan for this vast region, Northern Ontarians' needs were delayed in being met. Visual aid service providers in Northern Ontario were also much fewer than other assistive device categories, solidifying visual disability in the North as a disproportionate impairment. Today, visual aids under the ADP are accessible to Ontarians of all ages. Although this expansion was delayed many times in the 1980s, it would eventually come to pass due to the efforts of advocacy groups and public outcry. Advocacy from the Ontario Association of Optometrists and its members would also be left unanswered by the end of the decade. Now, optometrists are recognized as certifiers of blindness alongside physicians and ophthalmologists. In Northern Ontario, there are currently 11 visual aid vendors. This provides a similar number of vendors per capita when compared to Southern Ontario. However, the large land area of Northern Ontario means that an approximate 118-fold difference in vendors per square kilometre is present between Northern and Southern Ontario. Therefore, service discrepancies still exist, with Northern Ontario suffering from longer travel distances to visual aid vendors. Ontario's ADP has significantly improved accessibility to much-needed services and devices, with the establishment of a visual aids component serving Ontarians with visual impairments. Initial operations of the Visual Aids Subcommittee in the 1980s were fraught with challenges, feeling the pressures of catching up to already established device categories, of keeping up with expansions to adult clients, and of attempting to ensure accessible services throughout Ontario. External influences would also direct provisions from advocacy groups highlighting key service gaps, optometrists arguing for expanded rights, and individuals such as Edwin Roberts challenging ADP standards. While efforts should be maintained to ensure that activities best meet the needs of Ontarians, the developmental years for the ADP's Visual Aids Subcommittee have established a vital service that provides support for its clients and their site, so that they may better engage with their communities and may enjoy a better quality of life.